Houston chiropractor, Dr. Gregory Johnson, and we've got Eve today that has had a neck surgery twice now.
Yes.
In her cervical spine at the C5 through C7 level, where she's had 360-degree cage fusions with instrumentation. And we've also got her husband, Brian, that we're going to be treating. So I wanted to show you how we do that. Family care here at Advanced Chiropractic Relief. And we're going to show you how we do that. Okay, let's check your posture first, Eve. Okay. So first thing we always do, if you notice, is we check a person's posture, because posture is really a mirror of the spinal biomechanics. So we're going to have you close your eyes and flex your head forward all the way, and then backward all the way, and then neutral. And then I always document that on the X, Y, and Z axes. So she's got a little forward translation on the Z axis, so that's a positive SZ cervical in BioPhysics language. And her head is also translated just a little bit to the right, making her left shoulder just a little higher. She's got a little rotation to the left on the Y axis. We call that a positive theta Y cervical, positive theta Y thoracic. Her pelvis is translated a little bit to the right on the pelvis. That's a negative SX pelvis and negative SX thoracic too. Okay, good. You can open your eyes, Eve. Okay, so we see our posture before, and then we'll see it after we get done too. So I am going to decompress her, because now, Eve, tell our YouTube crowd here how many times you've tried to get in to see chiropractors that you couldn't get in to see, and how you came to see us. And
well, I didn't have any problems getting in to see you.
But I thought they wouldn't take care of you because they were afraid to adjust.
No, it was after my fusion.
Right.
They were afraid to adjust
right.
me.
So after your surgery, though, they would.
But they treated everything else.
Oh, they treated everything but your neck.
But right.
But you
Your
continued to have neck problems.
Different than their techniques.
And you were referred here by your massage therapist,
exactly.
medical massage therapist.
Absolutely.
Yep. Great. He's also
who was
great.
researching chiropractors to try and help me.
Yeah, and he found me on YouTube as well.
That's
yep.
right.
Okay, let's lay you on back there. Thank you for sharing that. Let's scoot you down this way just a little bit. Yeah, a lot of chiropractors for some reason are afraid to adjust a person who's had surgery in a certain part of their spine. Slide down this way a little bit. But quite frankly, once those areas are fused, they just move as a unit. So above and below that, the vertebrae move, and then the fused portion of the spine moves as one unit, or one vertebra, basically. So in her case, C5 through 7 moves as one unit. So we're getting movement down to C5, some C4, and then below that C7, T1. And she's got reflexes there, which are good. And we get this wet towel here, and we get it wet because it gives me a better grip on it to get around her occiput. And you notice I get myself down in the same plane that she's in. There you go. There we go, good. And I just give it it's just a straight vertical lift on the Y-axis. And she's still kicking, so that's a good thing. Now, I'm going to go below the fusion here. Excellent. And then above it here. No, I got one more here. Just tilt left just a little bit. There it is. See, that was her occiput atlas right there. So we adjusted below the fusion level at C7, T1, and then we adjusted above the fusion level at occiput, C1, and C2. And then we let her down, and she knows how to get up sideways, because she's been dealing with this how many years now?
Since 1979.
1979. So this would be considered chronic. Anything that's acute is less than 3 months old. Anything that's over 3 months old is considered chronic. Let's come over here and you tell me for us. That's how we categorize patients in the entire medical community, chiropractic community and medical community. An acute diagnosis would be like someone got in an automobile accident and sustained a whiplash injury. A lot of times, acute problems, like say a whiplash injury, will turn into chronic diagnosis after 3 months, because the patient's continuing to suffer from ligamentous instability or soft tissue injuries that can last a lifetime. And that includes sports trauma. Football is a really notorious one for injuring all parts of the spine, and concussions is a big deal, especially lately. And we've seen a lot of press on that in the NFL and even in the high school arena. I have a friend out in California whose son was playing football for his high school, and he's had 3 concussions already. So finally we got him talked into not playing football anymore, because if you get too many concussions you can have permanent brain damage. And even after having your first or second concussion, you can have what's called traumatic brain injury or mild traumatic brain injury, which can also develop into more severe neurological consequences later down the road, like Parkinson's, multiple sclerosis. Yep, I see that. I'm doing a lateral stretch in her lumbosacral area, her lumbothoracic area, sacrothoracic, all the way up here into her ribs. But I'm going to be putting my, now do you feel that one move right there? That was a rib on the lower rib cage. The last ribs are floating ribs, but they do attach all the way down to T12 in the lower thoracic spine. And so I'm putting my elbow right down in her, what I call the pocket. It's the quadratus lumborum multifidus and erector spinae muscles. And we're just going to have her continuing to take nice deep breaths in and out. Now she sees one of the absolute best massage therapists that I have encountered in my entire 33 years of practice. So, and actually, he's the one who referred her in here after researching her problems on the internet and finding us on YouTube. And then he started coming in as a patient himself, and I started getting massages from him, and he's going to be in here in a little while, so we're going to do a video with him as well. I know these are real sore. Sorry, you just tell me if it gets to be too much. Right now I'm down in her gluteus medius muscles, as well as now her piriformis, which Clay works on these areas a lot too, but he does a much more thorough job of getting into the origins and insertions of the muscles. What I'm doing is putting some very deep, steady pressure into the trigger points, or the toxic metabolic waste dumps of the body, or that are in the paraspinal muscles. And when people have those trigger points all over their body, that's when you have fibromyalgia. A lot of people are diagnosed with fibromyalgia wrongly. It's kind of a catch-all diagnosis for a lot of doctors these days, when in fact they don't really have fibromyalgia. They have several areas that have trigger points that need to be addressed. So chiropractic care and the type of massage that Clay does, who you'll meet in a little while, is excellent therapy for people who have trigger points and muscle spasm, as well as fibromyalgia itself, true fibromyalgia, chronic fatigue syndrome, post-surgical patients, just like Eve, to help break up the scar tissue, because anytime you invade the tissue with any type of surgery, you develop scar tissue formation. That scar tissue is a cheaper grade of material than normal uninjured tissue. It is permanently weaker. It is permanently less elastic, meaning it doesn't move as freely. And it is also permanently more sensitive than normal uninjured tissue. Okay, good. There we go.
What I have right here.
In that mid-thoracic, yeah. See, she's got Legs even now, and I bet you this one doesn't hurt as bad as the first one.
No.
Good. But you can see she's still got a little bit of a kyphosis right here, and that's really why he was referred in here in the first place, wasn't it?
Yes.
Your kyphosis? Yeah.
Mm-hmm.
And she's got some big old trigger points still here in her mid-thoracic spine. And this comes from a super common condition called forward head posture that has become epidemic in our society just from our sedentary lifestyles and work habits. A lot of people are working sitting at a desk all day behind a computer, working on a computer all day. I'm fortunate because I get to move around and do things, but you can see I'm bent forward a lot too, including my head, so I have to get adjusted regularly, which I did this morning. I've got another Houston chiropractor that comes in here and adjusts me, and then Clay does his massage work on. He's very thorough. So if you live in Houston, keep tuning in because we're going to have Clay on in just a little while, and you'll get all his information, and you can actually call him and get massage personally from him. He's very reasonable, very professional, and very specific. And I don't compliment people like that very often, but he is absolutely the best I've ever encountered in practice. And I think you'd probably agree with that too, wouldn't you, Eve?
Oh, yes.
Yeah.
Your phone's about ready to give up.
Yeah. Yeah, the pain gets so bad with people, especially chronic pain patients, that it causes a lot of times severe depression, chronic fatigue syndrome. Okay, let's sit you up and face towards your knee now. There you go. That's towards your knee. And it just really is a downward spiral of events that is not very good for anyone. So the best thing to do if you get an injury is to get it looked at immediately, because the quicker you get the inflammation under control and start working the injured soft tissues, the better they heal or remodel. Now see, she's still got a little crepitus or grinding here in this left shoulder that we're still going to get. I just pulled her bicipital tendon back, and then we adjust her glenohumeral joint. These guys are sore here too, aren't they? Mm-hmm. Your Cherry's major and minor muscles in the shoulders. Okay, now get your elbows and wrists. Okay. There. Boy, she's moving good all through her extremities.
You gonna use the turbo?
Yeah, I am. And I got kind of out of order here today, but I am going to go ahead and have her lay back on her tummy, and we're going to use the Turbonator on her. See, she even knows the name of it now. This is for the really deep tissue work that we need to do with people that have these big trigger points, hard tissue. This treatment is not for wimps. This is not for wimps, so this is for real deep tissue work. Okay, let's have you come over here and stand up in front of the mirror now. Next thing we're going to do is we're going to realign her atlas, which will send messages into her cerebellum, which is the hindbrain. That controls balance, posture, coordination, and all kinesthetic movement. So we're going to reanalyze her posture again. So let's start from neutral and go forward all the way and backward all the way. See, her range of motion is already improved. Now neutral. Chin's up better now. Her shoulder's not as high on the right anymore. So let's have you pull your shoulders up with your traps, back with your rhomboids, and then flare your palms facing forward. This tightens up all the upper thoracic musculature. Then we're going to, hold on, not swinging your hip yet. Bring her head straight back, and then we're going to translate her a little bit to the right. Now go ahead and translate your pelvis right. There you go. Good. Hold that right there. Then we tap the atlas here on the x-axis, and that's really the only way you can adjust the atlas like this, with this instrument on the x-axis. Okay, let's have you flex your head forward and backwards again. Very good. That should have felt smoother, did it?
A lot smoother.
Okay, good, good. Hey, would you mind telling, and we haven't rehearsed any of these, we never do. These are all real patients with real problems and unrehearsed, and all this is. Would you mind telling them what you think the difference is in our office versus the other chiropractors that you've seen?
There's just no comparison. It's one-on-one care. There's just no comparison.
Well, good. Thank you very
You know
much.
your stuff.
Thank you for saying
Thanks.
that, and thank you
And
for
thanks
letting
for
us do
helping me.
Oh, you're quite welcome. That's what we do here. Okay, we're going to do her husband right now, and so we're going to get Brian standing here and do his posture first. And let's have you take your shoes off too, Brian.
Yeah.
You're going to see me work on Brian's feet too, because he's had problems with some plantar fasciitis and misalignments of his feet, so we're going to be doing that. So Brian, let's have you close your eyes and flex your head forward and then backwards for me. Now back all the way. Now see, he's pretty restricted on extension there, now neutral. And he's got significant forward head posture. You can see how his head's looking down more. He's translated to the left on the cervical spine on the x-axis, positive SX cervical. And then down in his low back and pelvis, he is also translated to the left. He's not rotated as much though this week as he was last week. This is only your second treatment, huh?
That's correct. My wife recommended you.
Yes, true. Yep. That's where most of our patients come from, is referrals, which is good. Okay, so I'm not going to decompress you today. I'm going to do this one first. And then we'll decompress you. Sometimes I do this in different orders depending on the patient's problem. Not everybody's the same, so I don't treat everybody the same. I treat them for their individual issues. So as we have him laying prone here on the table now, as I'm checking his leg length, his left leg is about a half an inch shorter in this position than his right leg, but when I bring it up, you'll notice it's even already right there, and you watch his low back and pelvis right now. See how it's starting to raise up already? And I bet that's tightening up right there, isn't it, Brian?
Real tight.
Yeah. Not only in the back, but in his thighs here, I'm sure, too.
Yeah.
But the pelvis is out right here. These are the sacroiliac joints, so we're going to be adjusting his right one first. And I'm adjusting this one in a x-axis, the y-axis, and the z-axis simultaneously. And then we're going to do the sacrum, which is the middle triangular shaped bone in the middle of the pelvis. And then we're going to do the left sacroiliac joint. Okay. And same here. Yes. Yes. Okay, so you can see we're doing a lateral and oblique stretch of his spine as well. And then he's got very tight paraspinal muscles down in his lumbar spine. And again, I'm right down the very bottom at L5 next to the sacrum, which is where the quadratus lumborum and multifidus are. I didn't hear that clip today, so that's good. Yep. There we go. We'll go a little lower here. Was that one a little more sore?
Mhm.
Right? That's right where it was, huh? Yep. Now see, his gluteus medius muscles are like baseballs right now in consistency. They're very tense and tight. So he's also a chronic patient, meaning his problems have been in duration of longer than 3 months. So you've learned the difference between acute and chronic today. That's a good one, new one. There we go. And this is a lot of pressure that I'm applying, so it's pretty painful. And Brian's being a really good sport. He's not yelling too loud at all. There we go. But because of his plantar fasciitis, he's probably walked a little bit with a limp through the years too. But his legs are exactly even now. They stay even. His pelvis still raised up a little, but not as bad. Did that feel a little bit looser that time?
Sure did.
Alright, good. Just let this relax and breathe. Now when your feet hurt, it's a very, very painful condition because, of course, we have to walk on our feet every day, stand on them, and when they hurt, it's a very, very painful condition. So we're getting right down in his arch here, and you can feel the trigger points in his plantar fascia, which is the covering of the muscles on the plantar surface of the foot. Therefore, that's why it's called plantar fasciitis. It's inflammation of the fascia, the covering over the muscles that run along the bottom of the foot. So we adjust those, and then I get the turbonator out of here. All the way up to the ball of the foot out. You'll notice I never get on the heel. I get to where the tendons attach to the heel, but you don't ever get on the bone itself with the turbonator. Now that's better. Good. Okay, I'm going to put your head down a little bit here, Brian. Let me get your... There we go. Good. Okay. Yes, just breathe normal for me. You notice I close my eyes a lot of times when I'm adjusting patients because I feel the joint movement better. And he is just very, very stiff throughout his entire spine, which is why I do this first and then I decompress him to kind of loosen these muscles up a little bit before I do that. Okay, just let your head go right in my hands here. That's it. Excellent. Felt that one right in your skull too, huh? Mm-hmm. There we go. That was T1 and T2. And C7 down in the lower cervical spine, but upper thoracic spine, which he's got a lot of issues right up here. Okay, let's go ahead and turn you on your back now, Brian. So, I'm going to not finish adjusting his feet yet either, so I'm going to do the supine positioning. Put your hands right up on your tummy and relax on there. There you go. Drop your head right in my hands, and I want you to tilt right a little bit and wiggle your right big toe. Okay, wiggle your left big toe and tilt left. There we go, better. Sometimes you got to distract people just to get them to think about something else for a split second.
That's cheating.
Yeah, it's a little bit cheating, but it's a worthwhile cheat in this one. So see, I'm adjusting his toes now, which are the phalanges in his foot. And then on the big toe, I get a really good grip right at the base of the where the metatarsals and the phalanges.
Does it make any difference what size shoe you take or what size your foot is?
No, it doesn't make any difference to me as far as adjusting goes. It does make a difference.
Well, I'm concerned about wear and tear is what I was talking about.
Oh, wear and tear on your feet?
Yeah.
I think if you have bigger feet, you probably got a bigger chance of having more problems with your feet because they don't make shoes for size 14 as well as they do 10s through 12s for men. And you've got more surface area to compress through gravity throughout the day. There we go. Now these should be about straight, which they are. Good. Okay, now we're going to adjust his knee, and then we'll go all the way up into his hip and low back. Did you feel that all the way up?
Yeah.
Good. And then we'll do the same here. He's got a little lateral play here, you see, in his knee, so we get the knee adjusted as well as that goes all the way up into the lower back, isn't it?
That's
Here,
good.
let me help you up here, sideways, towards the knee, this way. There you go. Okay. Here, let me just have your shoulder here, look straight ahead. And you'll notice we adjust everything from head to toe, literally. Excellent movement on his right shoulder. I know you heard that one.
This is a tough one. This is
Yeah.
the one that's
This is one that gives you more
stiff.
problems.
Yeah.
Now, did you have surgery on this one already?
No.
He has an impingement syndrome in his shoulder. Now see, this one doesn't move as good as the other one because it's got more scar tissue around it. And you can see the limited range of motion on the left one compared to the right one as well. Probably hurts a little more on the left side when I do that too, doesn't it?
Right.
And the elbows. A lot of people are really anxious when I do their elbows because it feels like I'm going to break their arm, but I'm not. Martial arts training, actually, when I was young, I started martial arts when I was 13. I have 2 black belts, so that actually enhanced and helped my becoming a better chiropractor. Because when you know how to break the joints and where that's at, you know exactly where to stop short of all that to not cause the injury to patients. And that's very important. You want to stay within the integrity of the ligament itself in the joint. Very good. Now let's come over here in front of the mirror. Actually, you know what? Let's do this first. I'm going to decompress you first, and then we'll do the... Go ahead and lay on your back on this one. Now this is only... Huh? No, your head, feet down here.
Okay.
And head up this way on the tail. This is only Brian's second treatment, so we're getting pretty aggressive with him pretty early on. Because they live quite a ways from here, so they don't get a chance to come in as frequently. Okay, suck it up just a bit. There you go. Good. Now, he's in there real tight. I know he's thinking that's too tight, but I don't want him slipping through. Don't want him getting away. So you notice we always raise the legs up to where the lower part of the legs are parallel with the floor. That changes the angle of the pelvis, the entire pelvis, sacroiliac joints, and it relaxes the lumbar musculature. And as you saw, he's got decent reflexes on his knee there. Okay, now just breathe normal. Just like that. Perfect. Felt that all the way down, didn't you? That wasn't as bad as the first one, though, was it?
No.
But look at the difference already on his reflexes. You see the difference? In fact, research has shown that the weight of a dime on a nerve within 60 seconds can cause as much as 60% loss of function in that nerve, or alteration of function in that nerve. 60% in 60 seconds. So it's pretty lightning fast, these nerve connections. That's why we do pre and post tests on everybody and evaluate them every visit. Okay, let's come over and get sideways, remember? sideways, whichever one. That's not sideways. Here you go. Now let's stand over here. When you sit straight up like that, your tendency is for the vertebra to slip backwards, and that's where the nerves are, and that's where you get the pain. So we advise most of our patients to try to get up sideways. Okay, now let's flex your head forward and backwards again. Now see, he's already got a little bit better range of motion and extension there. Now back to neutral. Much better posture on that already. Can you see that from where you're sitting there? Yep. Okay, flip palms forward. Just keep that back here for me. Now, we're going to bring his head straight back in the Z-axis. And then I'm going to translate him a little bit here. And I'm also going to extend him more in the rotation on the X-axis. And then we're going to adjust the atlas there. And there. Okay, now relax. Okay, so this time, when he goes forward and backwards, we should see an increase in his range of motion. It should feel smoother to him. That was straight down, straight back, and back to neutral.
Good.
How'd that feel that time versus first time? Better?
Good. Much
Excellent. Good. And would you mind telling our YouTube viewers how you did on your very first treatment? Because that was a dramatic day for you.
Oh, yeah.
And us. I felt great even.
It's been many years since I've had, well, I'm an elderly person,
No, you're
senior
not.
citizen, and I've got aches and pains, and I was feeling pretty bad before I came, and my wife suggested I come see Dr. Johnson, and she said, you'll feel much better. And sincerely, I have felt much better since
Great.
I've seen you.
Super.
And I appreciate it very much, Dr.
Well,
Johnson.
you're quite welcome, and thank you for letting us share your story
You're
on
welcome.
YouTube.
You're welcome.
Thank you. This is your Houston Chiropractor. We'll see you next time.